Achilles tendon is the strongest tendon in your body. It attaches in the back of your heel right here. When people have Achilles tendonitis, there's basically pain and inflammation on the back of the heel related to physical activity. That's very common, perhaps running or even taking up something high intensity where the Achilles tendon gets pulled too much, and basically there's pain and swelling that result. When patients come and see me, I do biomechanical gait analysis. There's also tippy toe test where sometimes patients have trouble going on their tippy toes. On x-ray, there could be some spurring or changes in the back of your heel where Achilles attaches. That's usually common in chronic Achilles pulling. I also do ultrasound to see if there's thickening of the Achilles tendon. Normally, the treatment that I do is physical therapy to make sure we correct the actual inflammation of the Achilles itself, but also treat the underlying cause, because there are underlying causes that predispose you to getting the Achilles tendonitis. And that's very important to make sure that when you come in, that I diagnose it and make sure that it doesn't come back. And that's where it's critical, because just rest, ice, elevation, anti-inflammatories might get rid of the problem right away, but it will come back. And also, there are other changes that we need to make, such as custom inserts if you need it to correct your foot biomechanics, and also changing shoe gear that might be important in the long run to make sure this problem never comes back.